Weight loss, pregnancy, and age can change every aspect of a woman's body, even areas that affect intimacy. Dr. Robert True offers safe and effective solutions in the privacy of his Arlington office.
The one type, the laser vaginal rejuvenation, is simply the technique whereby we can change the anatomy of the vagina such that it allows for enhanced sexual gratification. The other type, the cosmetic type of outside surgery, outside of the vagina, is called a labiaplasty. And this type of procedure is used in order to reduce the labia minora to a more cosmetically appealing look. In other words, women want to feel better about themselves. They want to feel better about the way they look. That includes the way they look in their face, their body, but also in their genital areas. When a woman has a child, a lot of times their area in the bottom part of the vagina kind of separates apart. The muscles separate apart. So a lot of women tell me sex is just not as good as it used to be. And part of the reason is they don't have the frictional forces. The vagina is kind of lax, it's loose, and they don't get that same sensation. So in order to enhance that sensation, we do procedures to help a woman out. This procedure is called vaginal rejuvenation. It's cosmetic vaginal surgery, whereby we can reattach those muscles, put them back together, tighten the vagina such that they can get those frictional forces to enhance the sexual gratification of a woman. It's a very good thing for women. They feel better about themselves when they do this.
Dr. True says this procedure is performed in the office with IV sedation.
Then we use a special fluid called tumescent fluid to numb the areas in the lower genital area. Then we repair the muscles. We bring them together in a special technique, a special way, such that it causes the vagina to be tighter and allows the muscles to be able to constrict easier. One of the ways of doing this is to use a laser. The laser is a very beneficial instrument in order to help to make the edges clean, in order to decrease the bleeding. It's a new technique that has been invented by physicians. It seems to work very, very well to help the woman to have this result of improved sexual gratification. While a woman ages, a lot of times the labia minora will extend, they will enlarge. Sometimes one will be longer than another. A lot of it is genetics. It'll determine how long they are, but it is just not very cosmetically appealing to a lot of women. They don't feel good about themselves down there. Childbirth does increase that too. During pregnancy, a lot of women will have an hypertrophy of their labia, and this is not appealing to them cosmetically. Therefore, they want to feel better about themselves down there. The labia minora is the smaller labia in the vulvar area, the inner lips, if you will. And women don't like the inner lips extending past the outer lips. It just doesn't look very appealing. So we do this reduction labiaplasty in order to make them feel like they look good in their genital area. It makes them feel better about themselves.